So thank you for everyone for joining us on this webinar, Clinicians as Advocates, State Ballot Initiatives on Abortion. A few housekeeping items before we begin. We'd greatly appreciate it if you can keep yourself on mute unless you're asking a question. This will just cut down on background noise. Speaking of questions, while we do have time allotted at the end of the presentation, feel free to unmute or pop a question in the chat at any time. And for anyone who wants to ask a question anonymously, we will have an opportunity at the end for you to submit a question on Poll Everywhere. And lastly, this webinar is being recorded. So my name is Samantha Berg, and I am the Manager of State Advocacy for the Society for Maternal-Fetal Medicine. I know we have quite a few folks joining who are not SMFM members, so for those who don't know, we are a nonprofit association with over 5,500 members, our core membership being maternal-fetal subspecialists. We are dedicated to advancing optimal and equitable perinatal outcomes for all who desire or experience pregnancy, and our work falls under 3 overlapping categories: advocacy and partnerships, member engagement and support, and knowledge, education, and research. So under our advocacy and partnerships bucket, we have a relatively new initiative, our State Liaison Network. So this is a member-led program that focuses on state-level advocacy and the implementation of state-based public health programs. And we aim to harness the power of our clinician leaders in each state to provide intelligence and really serve as our ambassadors and our advocates. We've worked with our members on a number of advocacy activities, including drafting legislative testimonies, submitting reports and letters of supports to legislatures, and more. So for today's SLN webinar, we're going to be focusing on ballot initiatives. So we'll go over a brief history of ballot measures related to abortion, discuss upcoming initiatives, including how to get involved, and then leave time at the end for questions. Note that we'll also follow up with everyone who's here and who registered with additional resources to support your advocacy around these initiatives. Before we jump in, I want to start with 2 anonymous poll questions. So last chance, if you haven't already, go to the link on your screen. You can use the QR code by scanning it with your phone's camera. And the link, again, is also in the chat. So the first thing we want to know is where you're practicing. And if you're primarily a telemedicine provider, where you're based. And this is just to help us understand where folks are joining from and where you all have the potential to impact policy. So it looks like we have some East Coast, some West Coast representation filling out. Great to see where everyone is. Awesome. And just for our second question, we want to gauge how comfortable you are in advocating for abortion in your state. So again, this is totally anonymous. And this will, again, just help us plan future programming to meet you where you're at in your advocacy experience. So it looks like we have a good mix, some people in the middle, some people less confident, and some more. Awesome. So diving into our content for today, ballot initiatives or referendums are proposed statutes, amendments, or veto reforms that are essentially decided by voters. So this process allows for citizens to have a more direct say in the policies that impact them. There is no singular process for getting a measure on the ballot. There are citizen-initiated processes as well as government-initiated processes. So for the citizen-led ones, we have initiated state statutes or constitutional amendments, which, as you may guess, can change state law or the Constitution. And these are often considered the most straightforward, as the process requires collecting a certain number of signatures, and then the measure goes on the ballot. There's also an indirect version for each of those where the legislature has to be involved. So after the signatures are collected, the legislature can either not act or reject the measure in its regular session, in which case the measure goes to the ballot. The legislature can decide to just pass it as written or amend it, in which case it would not go on the ballot. Or the legislature can create its own measure on the same subject, and then both of them go on the ballot. So a bit more convoluted in those scenarios. And then we also have fetal reform, which is a measure that asks voters whether to keep or repeal a law that was previously passed in the legislature. So under government-initiated measures, we have similarly legislatively referred statutes and constitutional amendments, and these processes are required to pass the legislature in order for the measures to get on the ballot. There's also a referred bond issue, which relates to spending, and then commission referred measures, which is essentially a measure that needs to be ordered by a commission, but that only exists in Florida and Arizona. So there are only 26 states that allow for citizen-led ballot initiatives. So this means that if you're living in a state that only allows for government-led initiatives, you need to work with legislators to introduce a measure. Of the 26 states, 11 have laws currently restricting abortion access, with some temporarily blocked in courts. So in these states, ballot measures could be a useful tool to fight back against those restrictions. And in the 15 other states, ballot measures can be a tool to safeguard abortion access so that no future legislature or court can impede on reproductive autonomy. Ballot measures have been wildly successful in the past in passing progressive laws or constitutional amendments, from marijuana legalization to increasing minimum wage to same-sex marriage legalization. This has been a really important tool in giving voters a voice, especially in a time when gerrymandering and voter suppression methods are really taking away that voice. But the success is not without its backlash. It may come as no surprise, but multiple conservative-leaning legislatures are really trying to limit the use of these processes. For example, in Arkansas, the legislature is asking voters to approve a constitutional amendment that would raise the threshold for ballot initiatives from 50% to 60%. South Dakota tried something similar this year, but failed to get enough votes to put it on the ballot. An irony that is not lost on them, apparently, or that is lost on them because they're trying again next year. And lastly, a conservative-leaning court in Mississippi blocked the state's ballot initiative process. And the legislature is trying to add the process back, but they're stripping it of a lot of its previous bylaws, so it would make it a lot more difficult for citizens to succeed in the future. In terms of ballot initiatives impacting access to abortion, there have been a total of 48 since 1970, and about half of these have been since the year 2000. And Colorado has had the most measures related to abortion at a total of 9. Of these 48 measures, 41 were introduced or supported by anti-abortion organizations. And of those, 11 were approved and 30 rejected. So those 11 states are bolded here in red on your screen. And they ranged from topics like parental notification laws to bans on public funding to no constitutional right to abortion at all. And then the remaining states that had measures that were not supported by anti-abortion organizations, 4 of those were approved and 3 rejected. And so those 4 are bolded in green on your screen. Looking at this timeline, it's definitely disheartening to see the amount of red compared to green, but remember, a majority of the initiatives that did not pass were anti-abortion. So that is something to feel good about. One of those states and the most recent ballot on abortion was the Value Them Both Amendment in Kansas. I'm sure everyone is aware, but on August 2nd, Kansas overwhelmingly voted against this amendment. And had it passed, this measure would have amended the state's constitution to say that nothing in the document creates a right to abortion or requires government funding for abortion, and also would have enabled lawmakers to pass laws regulating abortion in the state. With nearly a 20-point margin, the campaign was wildly successful and really provided much needed hope for abortion access in Kansas and beyond. So beyond Kansas, there are 5 states with ballots on abortion this November 8th. So using the same poll everywhere link as before, I want to read through each one and see how you guys would vote. I'm sure you'll all get it right, but just a fun little activity we can do. So for state 1, the text includes language that the state shall not deny or interfere with an individual's reproductive freedom in their most intimate decisions, which includes their fundamental right to choose to have an abortion and their fundamental right to choose or refuse contraceptives. This section is intended to further the constitutional right to privacy guaranteed by Section 1 and the constitutional right to not be denied equal protection guaranteed by Section 7. Nothing herein narrows or limits the right to privacy or equal protection. I'll give everyone 5 more seconds to vote. And this text is from California's upcoming ballot measure, Right to Reproductive Freedom Amendment. As everyone guessed, the correct answer to protect abortion access is yes. So as stated, the right to privacy already exists in California's constitution, but it does not explicitly include reproductive autonomy. So voting yes for Proposition 1 would change this by adding explicit language to protect Californians' reproductive freedom, including abortion access and contraception. While voting no would not remove access to abortion, it would put that access to be more vulnerable. So at a time when patients are flocking to California for abortion care, it's really more important than ever to solidify that reproductive autonomy is a constitutional right. So moving on to state 2, the ballot measure reads, are you in favor of amending the Constitution of State 2 by creating a new section of the Constitution to be numbered Section 26A to state as follows? To protect human life, nothing in this Constitution shall be construed to secure or protect a right to abortion or require the funding of abortion. Give everyone a few more seconds. So that's from Kentucky's No Right to Abortion and Constitution Amendment. And again, you're all geniuses. You all said no. This amendment is, if passed, would end the debate over privacy and self-determination and explicitly say that abortion is not included in any interpretation of Kentucky's constitution. Stopping this measure does not just prevent further incentive for anti-abortion advocates to push harmful laws, but it also protects a really critical path to fighting abortion bans in Kentucky. Since the circuit court blocked Kentucky's trigger ban based on the rights to privacy and self-determination in sections 1 and 2 of the Kentucky Constitution, it's really important that this amendment is defeated. Otherwise, that trigger ban will go back into effect, and it will leave us essentially no recourse outside of the legislative process to remove that ban or any future restrictions. So state 3, this is long, so I won't read the whole thing. But every individual has a fundamental right to reproductive freedom, which entails the right to make and effectuate decisions about all matters relating to pregnancy, including but not limited to prenatal care, childbirth, postpartum care, contraception, sterilization, abortion care, miscarriage management, and infertility care. So this ballot is the Right to Reproductive Freedom Initiative in Michigan, and the correct answer, as you all said, is yes. So similar to California, a yes vote for this measure would explicitly affirm a constitutional right to reproductive autonomy, whereas a no vote would leave the Constitution as is. Again, this would allow for interpretations to include protections for abortion, but this would also risk access depending on the legislature. Currently in Michigan, there is a 1931 law that's threatening abortion access. It has been blocked by a court, which is great, but there's also a risk of appeal, and we never know what future bills are going to be introduced in the legislature. So state 4, almost done. An act adopting the Born Alive Infant Protection Act, providing that infants born alive including infants born alive after an abortion, are legal persons requiring healthcare providers to take necessary actions to preserve the life of a born alive infant, providing a penalty, providing that the proposed act be submitted to the qualified electors, and providing an effective date. Everyone was really fast in saying no, which is great because this measure in Montana is the medical care requirements for born alive infants measure. And we definitely want to say no to protect access to care. So this ballot differs from the others as it's not actually debating a constitutional right to abortion. In fact, if you get to the heart of this measure, it's not really about abortion. Rather, this measure would require clinicians to provide resuscitative or other quote unquote life-saving care to any infant born with a heartbeat, breathing, or moving, regardless of gestational age or underlying medical conditions. And providers who do not provide such care would risk felony charges, a $50,000 fine, and up to 20 years in prison. So proponents of this measure are using inflammatory language about abortion, suggesting that abortion is equivalent to infanticide, and really harping on that born alive language, which we know is not an actual term that we use to appeal to voters to say yes. But we know that this measure is going to primarily impact patients who give birth prematurely or who choose terminations because their newborn is dying or because their health or life is at risk. And so this measure would mean that these grieving families won't get the option to hold or comfort their child or provide spiritual care. This measure has largely been flying under the radar in Montana, which is something that supporters are hoping will continue because this language about a born alive infant can be really confusing to voters, especially if they're not in the medical space. So moving on to the last ballot measure that's going to be voted on November 8th. This one reads that an individual's right to personal reproductive autonomy is central to the liberty and dignity to determine one's own life course and shall not be denied or infringed unless justified by a compelling state interest achieved by the least restrictive means. So this language is from the Vermont Reproductive Liberty Amendment, and you guessed it, the correct answer to protect abortion is yes. So voting yes to this measure would add explicit language to the Constitution guaranteeing all Vermonters' right to reproductive liberty, much like in California and Michigan. Again, voting no would leave the Constitution as is, but risk that access depending on future legislation. We've heard that supporters of this amendment are currently addressing misinformation from opponents who are leaning into falsehoods surrounding later abortion. So definitely could use messaging support from providers in the state. So looking past 2022 and the 5 upcoming ballot measures, there are at least 7 states that may have abortion-related measures in the next 2 years. Some will be proactive to protect abortion, while others will be attempts from anti-abortion groups and legislators to restrict reproductive autonomy and even criminalize abortion. So these are the initiatives we're aware of. There may be others, including states like Arizona and Colorado, both of whom failed to get initiatives on the ballot this year. And it's also possible that the ones on your screen won't make it to the ballot. We've also heard murmurs that there may be a ballot in Oklahoma, but that's still up in the air. And also last week, Wisconsin's governor announced that he is calling the legislature into special session on October 5th to consider a constitutional amendment to repeal a ban from 1849. So that referendum would have to pass through 2 sessions of the legislature, according to Wisconsin's bylaws. So unclear as to when voters would actually get to see this on the ballot, but definitely something that we're going to be paying attention to. So even though November 8th is quickly approaching, campaigns are still actively recruiting more volunteers and specifically recruiting medical experts to support their campaigns. As clinicians, you're already advocates for your patients in the exam room, but your expertise means you can also be great advocates outside the exam room, especially when it comes to these initiatives. So campaigns are looking for subject matter experts to help with messaging, to connect to voters, and really solidify the importance of protecting abortion access or opposing these unnecessary bans and restrictions. There are so many ways to get involved, but we are going to focus on 6. So in states with citizen-led initiatives, you can volunteer early with campaigns and help collect signatures. This process requires talking to folks in your state, and who better to educate them on ballots that impact abortion than their clinicians who really understand the impact of these measures on patients, families, and your colleagues who could potentially face criminal charges. Another benefit to working with campaigns early is the potential to influence strategy. So ballot campaigns are typically led by policy and communications experts. But when it comes to campaigns involving healthcare, especially abortion, it's also really important to have medical professionals involved to really bring in the provider and patient perspective, and dispel myths and connect to voters in a way that other folks can't. Obviously, for the 5 upcoming initiatives, we are well past the signature collection and strategy phase. But if your state, potentially has something on the ballot in the next couple of years, or maybe you think your state should have a measure, you can definitely be a part of this early stage. So for the campaigns that may be coming up in 2023 and 24, 4 of them are citizen-led initiatives and will require signature collection. So you can see on this chart that for these measures, the number of signatures required is actually tied to number of votes cast in previous elections. But even for the measures that aren't citizen-led, you can still get involved with campaigns on the strategy front. Another way to support ballot campaigns is to help get out the vote. So helping your colleagues, patients, family, and friends register is really important because you can't participate in a ballot measure if you don't vote, and you can't vote if you aren't registered. Last week, September 20th, was National Voter Registration Day, and that really signals the first registration deadline ahead of November 8th. Thankfully, the 5 states with upcoming ballots have not reached their registration deadlines yet. So this means there's still time to talk to your networks and underscore the importance of these ballot measures and why they should vote. There are a number of resources designed to help you navigate these conversations. For example, Voter is a nonpartisan organization that's geared towards healthcare professionals who want to spread the word about civic engagement. You can request a free badge off their website, and each badge contains a QR code so patients and colleagues can scan it and start the voter registration process right on their phones. And for folks in states that have mail-in ballots, you can even request a ballot through this link. Having a badge will also signal that you are available to answer questions about voter registration in your state, which is important because not all folks understand the process. Another resource that you can use is TurboVote. It's a great tool to get folks registered and even sends reminders either via text or email about early voting, poll locations, and other things to know for Election Day. We also have resources from the Association of Women's Health, Obstetric, and Neonatal Nurses that will be circulating later. They have great messaging resources for healthcare professionals on abortion and voting, so very relevant to these measures. For those who want to get more involved in the nitty-gritty of a campaign, canvassing is a tried and true method for engaging voters and sharing messaging. So as clinicians, your expertise will be especially useful in building trust with voters and potentially swaying voters who are on the fence or just don't understand the impact of the ballot measures. With November 8th approaching, campaigns are doing a lot of last-minute outreach to voters, including canvassing. So I know Kentucky's campaign is adding canvassing dates every week to their website. And Michigan organizers told us that they have dates, big canvassing dates on October 1st, this Saturday, and next Saturday, October 8th. And they specifically mentioned that they want clinicians to join in on these efforts. For the other states, California, Montana, and Vermont, you can sign up for their email list and you'll get updates on canvassing opportunities. So message sharing goes beyond this door-to-door knocking. A lot of it happens virtually. Campaigns often host phone banking and more recently text banking events where they essentially have a list of registered voters and a call or a text script, and then they ask volunteers to make as many calls or texts as they can in a period of time. You can actually work with campaigns to tailor these scripts so that you can highlight your expertise as a provider instead of following the generic language they put together for their other volunteers. This way you can speak directly to your expertise, which is, a major asset to these campaigns and why they're specifically looking for clinicians to volunteer. Another way to share messaging virtually is through social media. So as voters increasingly get their news from sites like Facebook and Twitter, as much as we may like or dislike that, it's an important tool in spreading awareness and countering misinformation. Even if you don't have a big online network, sharing and boosting posts can help get the right information, gain traction. This table includes the campaign accounts and hashtags that you should be tagging in posts. And here we have a few examples of some posts that have successfully used these tags and hashtags to share messaging. I'm sure everyone's familiar, but if you're not, a hashtag, you can click on it so people who don't follow you or otherwise see what you post on their regular feed can scroll and see all the posts that use that hashtag. So even if you only have 50 followers on Twitter, if you use the hashtag, you can reach so many more people. While the previous four methods are critically important to campaigns, one of the most unique ways that you can support ballot initiatives is by serving as subject matter experts in the media. So for written media, campaigns are looking for providers and patients to pen op-eds and LTEs, as well as speak to reporters for newspaper or magazine interviews. So I know SMFM frequently gets requests from reporters to talk to our members, especially in states where abortion access is at risk. And so this type of advocacy we know can have a huge impact because it can reach so many people at once. Here are some recent clips from 3 of the states with upcoming ballot initiatives. So the first is an op-ed penned by SMFM member Dr. Tim Johnson in Michigan. In this piece, he leans on his experience providing care for patients with high-risk pregnancies and urges Michiganders to vote yes on Prop 3. The second is an op-ed from a physician in California, Dr. Shannon Connolly, and she dispels the myths about Proposition 1 and explains why this amendment is really important for Californians. And the third is an article about Montana's referendum in which SMFM member Dr. Tim Mitchell is interviewed, and he discusses the false narratives around LR 131 and the importance of voting no. So for our members who are interested in penning op-eds or being interviewed, SMFM can help provide resources, including message guidance and more, as will these campaigns. They do a lot of media training and want to make sure that you feel prepared to be interviewed or to write a piece. And for those who are eager to get involved even more, campaigns are also looking for clinicians to take part in live media, so radio, TV ads, and interviews. And having a provider deliver these messages, just like with canvassing or phone banking, can really increase trust with voters and the campaign. So again, SMFM, we can provide our members with support on this, as can the campaigns. But an important thing to note is that these requests often come last minute following the natural news cycle. So a campaign might get a request at 9 a.m. to interview a provider at noon. So really these campaigns are looking for providers they can put on a list that they can, run down and call everyone to see who is available to take that interview. So I want to show just a quick 2-minute clip of Michigan providers talking about the ballot initiative. I think it was right after the Dobbs decision.
As physicians, we condemn Friday's ruling from the U.S. Supreme Court overturning Roe v. Wade.
It's a call to action before it's too late.
Politicians shouldn't be telling doctors how to take care of women dealing with medical emergencies or other crises.
Although Michigan is one of a few states where abortion is currently legal, it's unclear for how long. That's why these doctors are shining a light on a ballot initiative to protect the right to legal abortion in the state.
The Reproductive Freedom for All ballot proposal would establish that women in Michigan have the right to decide to have an abortion during the first 24 weeks of pregnancy.
It would also protect the right to have an abortion in cases of medical necessity and crimes like rape.
When abortion is legal, maternal mortality drops dramatically. Legal abortion is really a public health intervention.
Doctors also make it clear that most abortion bans are not always clear and can put patients in jeopardy.
My concern is that doctors and their teams will hesitate to act because they're worried about the legal repercussions to themselves, and that will put a woman's health in jeopardy.
As things continue to evolve, some want to know if FDA-approved abortion pills would be legal to use.
Certainly mifepristone use would not be legal under Michigan's 1931 ban.
Some doctors across Michigan believe decisions regarding an abortion should be made between a woman and her doctor.
And politicians shouldn't be telling Michiganders how to navigate healthcare.
For information about the Reproductive Freedom for All initiative, go to fox2detroit.com.
With Roe v. Wade overturned, it's on all of us to help keep abortion legal by passing this common sense law.
In Southfield, Ingrid Kelly, Fox 2 News.
So as you saw, the providers in this clip were able to take the interviews on Zoom, so they didn't have to disrupt their schedules to accommodate in-person interviews. And for folks who are interested in this type of advocacy, Dr. Lisa Harris, who is one of the interviewees, and her research team are actually hosting a messaging training geared towards Michigan providers who want to advance abortion access. It's this Sunday, October 2nd from 6 to 9 p.m. Eastern time. And if you're interested, you can reach out to me after the webinar and I'll send you the additional information. Dr. Harris did say that anyone can attend, but it will be very specific to Michigan's ballot. So I know I've been talking at you for a long time, but before we turn it over to you for questions, I want to go through the 5 campaigns that are leading the efforts in their states. So in California, the Yes on One campaign is a coalition of California abortion advocates, including Planned Parenthood, Black Women for Wellness Action Project, the ACLU, and many more organizations. It's also supported by a number of local healthcare orgs, including ACOG District 9 and the California Medical Association. And the QR codes on your screens will take you right to the campaign websites, but of course, we'll provide this information after the webinar. If you want to support the Yes on One campaign, you'll find a whole host of resources on their website, including a really thorough activist toolkit. So this has a fact sheet, which is on the right side of your screen in both English and Spanish, sample social media photos and tweets, virtual backgrounds for Zoom and other web services, and so much more. They don't have an events page, so if you want to be plugged into phone banking and canvassing events, you'll need to sign up for their emails. And in terms of messaging, I know they're currently trying to counter misinformation claims from this opposition group called California Together, which is spreading misinformation about how this is going to increase taxes for Californians, since other folks will be coming to California for abortion care. The reality is people are already coming to California for abortion care, and that's not going to change whether this measure passes or not. Additionally, this ballot has nothing in it that's going to change taxation or payment for abortion services. It's just going to solidify that abortion is a constitutional right in the state of California. So in Kentucky, the campaign working against the anti-abortion amendment is Protect Kentucky Access. And they're a collection of nonprofit and communication organizations, including Sister Song, ACLU, Planned Parenthood of Kentucky, Kentucky Black Birth Workers Alliance, and more. And they have 3 priorities listed on their website, which are to defeat the constitutional amendment, to create an environment where Kentuckians feel safe to speak about abortion and reproductive health, and to build a strong movement of Kentuckians to defend reproductive freedom. If you're interested in supporting Protect Kentucky Access, they are constantly adding new events to their website. The ones on your screen, I took a screenshot of yesterday, so I'm sure there are even more that were added today. They also have a grassroots toolkit that you can download once you sign up, and it has so many resources like social media graphics, talking points, and more. The Reproductive Freedom for All campaign in Michigan has been hard at work promoting Prop 3. You may have actually seen that the Board of State Canvassers initially refused to certify the signatures at the end of August, even though the campaign well surpassed the required amount of signatures. And the board only certified the results after the state Supreme Court stepped in. If you're a Michigan provider, you may have actually signed an open letter from providers to voters to support this initiative, and this was circulated prior to the Supreme Court's decision to really put pressure on them to make the Board of State Canvassers certify those signatures. The RFFA has partnered with organizations like ACLU of Michigan, Michigan Voices, Planned Parenthood Advocates of Michigan, and more. And just like the other states, there are many ways to get involved with this campaign. They too are constantly adding new events and also have a page where you can sign up for event updates so that you never miss one. And I think I mentioned earlier, they have 2 big canvassing events coming up on October 1st and 8th, and would love to have providers get involved. And they've also mentioned to us that they really want to have more providers that are able to do live media interviews and potentially ads. So again, if you're interested, I can put you in direct contact with their staff. In Montana, the No on LR 131 campaign is led by Compassion for Montana Families, a coalition of organizations, community members, activists, and healthcare providers across Montana. You can learn more using their QR code. They just launched their campaign last week, so their website is relatively new. There's a small group of providers in Montana that's also organizing with this campaign, but they're definitely looking for help, especially in circulating an open letter to providers in the state, and that's actually being launched today. They're especially looking for providers in Bozeman or Butte because these are more conservative parts of Montana. So having providers in those communities speak out against LR 131 would have a really big impact. And for folks who want to get involved there, you can go to the campaign's website and sign up directly for alerts. And actually, it's kind of hard to see, but on the right side, the form you fill out, you can actually check off what types of events you're interested. So for example, you can check off phone banking, writing an op-ed, administrative support, or however I can help. And this way you'll get emails tailored to how you want to contribute. And I mentioned before that this campaign is looking for support because the born alive terminology is really confusing to voters and there's just a lot of misinformation. So having clinicians in their network would really impact their campaign. And last but not least, the Vermont for Reproductive Liberty Ballot Committee is led by the Planned Parenthood Vermont Action Fund, the ACLU of Vermont, Alliance for Better Vermont, and the League of Women Voters of Vermont. They just had a weekend of action this past Saturday and Sunday, which was basically like a blitz of activities. So a lot of phone banking and canvassing events throughout the state. But that does not mean that there will not be more opportunities to get involved. So they also have a toolkit, including FAQs, messaging guidance, social media resources, and more. They're specifically asking folks to take the pledge to vote yes on the Reproductive Liberty Amendment, regardless of whether you plan on doing additional advocacy support. And they want folks to not just pledge yes, but also send this to their networks in Vermont. So I know we have a lot of folks who are on this webinar who are not in those 5 states. So if you're interested in getting involved, you still can. These campaigns often accept help from virtual volunteers across the country to help with message sharing, so phone banking, text banking, and more. And regardless of where you're located, if you don't have the time to commit to do these activities, campaigns will happily accept donations from anyone. Funding is really important to these campaigns to essentially buy ads, help them buy resources to canvass neighborhoods, to purchase lists of registered voters, and to even hire more staff to help with their messaging. If you think your state needs a ballot measure, you can also connect with local advocacy groups. I'm sure you saw a common thread with all of those campaigns that they're working with their local Planned Parenthood and ACLU, as well as other grassroots organizations. So you can see that if they're if you're not sure if there's a ballot measure, you can contact one of those organizations to see if they're working on a future ballot in your state. And it might just be the case where they're unsure if they're going to move forward. So having your involvement and expertise may just be what's missing. So that's the end of me speaking at you. I'm going to open it up for questions. So you can unmute yourself. You can drop a question in the chat, or you can post an anonymous question on Poll Everywhere. And I'm going to stop sharing my screen so that I can monitor the chat. I did not stop sharing. There we go.
Samantha, there is one question in the chat, just to get us started. Can you share any efforts or campaigns in states that currently prevent citizen-led ballot initiatives to change the laws?
So if the question is asking to change the laws around the ballot initiative process, I'm not aware of any states doing that. Really, the only states that we're aware of that are changing the processes are conservative leaning states that are trying to reduce the ability to have this citizen-led process. So unfortunately, not seeing that being expanded anywhere. But if the question is about, sorry, can you share about states that have initiatives that are government-led? I think a number of states in 2023 and 24 that have measures are government-led. So New York has one, Pennsylvania has one, and there may be others as well in the future. And yes, someone posted in the chat that Arizona is trying to reduce this process. Arizona, South Dakota, Mississippi, not great. Can you recommend ways for non-medical citizens to help out when no ballot initiative is in their state? So really anyone can help a campaign. You can sign up for their email alerts and help with phone banking and text banking. Basically, they just need people who are willing to call voters in their state on the phone and connect with them and try and get out the word about the ballot measure. You can also share information on social media using those hashtags and whatnot. And even if you have networks in these states, whether it's one or two people that you know, sending them information and asking them to help send to their networks can make a difference. Because if you know one person who knows two people, who knows three people, that can really snowball and increase support and awareness. Do we have any other questions? Folks can feel free to unmute themselves. Quiet bunch today. Well, if folks don't have more questions, I'm not going to force you to sit on Zoom for another 30 minutes. I know you all have very busy lives. So feel free to hop off, and we'll be sending additional materials in the coming weeks to support your advocacy. And I'll also be happy to stay on for the next 10 minutes or so if you have a question you want to ask one-on-one. So thank you everyone for joining, and we'll be in touch soon.
I have a question for you. I just posted the question about non-medical people doing, things they can do. Mm-hmm. What about those folks? Because we're going to be having an information session the end of next month. I'm going to have people who are really interested in figuring out what they can do to help. So I'm in New York State, so we don't have anything at the moment for this year.
Absolutely. So New York does
what's their best thing? Yeah, I saw you had something for 2023.
So I would say, and I can help track down this information, is first to connect with the campaign directly and see where they're at in this process. I don't know off the top of my head when the signature collection process can start for New York, but it's very possible that it has started or will be starting soon. So I think the biggest thing initially is going to get people who are willing to help with that signature collection, whether you're a medical professional or not, because it can't get on the ballot if you're you don't have enough signatures. So I think that's going to be step one. And then really anything that we spoke about today, so canvassing and phone banking, They are really important, but it's also really hard to get volunteers to do those things because it involves talking to strangers and, even going out door to door. So if folks are, gung-ho about being part of these campaigns, those are really impactful ways to connect to voters and spread messaging.
Okay. And so it sounds like it would funnel everything through the campaign directly.
I would say so, yeah.
Where they are.
Yeah, they're
Okay.
going to be the experts and they're going to have the messaging that they know is going to work, especially in various communities. I know, I'm in New York as well. So parts of New York are much more progressive than others. So they will have the resources to speak to perhaps the less progressive parts of New York to persuade them to vote for the amendment. So.
Okay. And so you said you can, how do we find out who's I find out, like, to get in touch with this campaign?
I'm going to drop my email in the chat. And if you just want to email me, and I will do some research and let you know.
Great. Yeah. Thanks a lot. Appreciate it. Nice talk. Thank you.
Thank you so much. Great. Well, if we don't have other questions, I think folks are probably just away from their mouse. So I'm going to say goodbye to everyone. Thank you so much for joining. And again, we'll follow up.